work is focused on urban communities in Miami, and you've said before that there are a lot of similarities between what those populations experience and what someone in an impoverished country would.
Absolutely.
What kind of lessons learned can domestic U.S. AIDS policy learn from the international experience?
Oh, my goodness. That's a loaded question. We can learn that our resources need to be comprehensive. For example, when I went into Overtown and I was recruited to the University of Miami to do this, we had no HIV testing. So obviously you're not going to have any impact on HIV prevalence if there is no HIV testing. And also using our local community partners. I think that our communities, our urban inner city communities, and ideally, I mean, it's ideal this conversation is happening in Washington, D.C., where our HIV rates do mirror that in many parts of many of the worst areas of the world. I haven't seen any community health workers since I've been here in Washington, D.C., telling me about HIV education, and I look like the target population. And that's what I think we need to see more of. I haven't seen any billboards, but what I do see is every time I walk down a street in D.C. and I see more than one minority, I try to estimate in my head how many are HIV positive. And it's scary as an American in our American society, in our capital, that that's what I'm thinking about. So the lessons that I've taken from Haiti and from Cuba and from Thailand are really pay attention to the behaviors that are increasing transmission. Throw your morality out the door. You're going to sit here and judge people, then you're going to increase poor outcomes and more racial and class disparities in HIV.
I just want to ask Dr. Gosby if he has any thoughts he'd like to share with this public policy kind of audience about what your next steps will be in terms of carrying the PEPFAR strategy forward, both within this administration to get the funding and globally.
Well, thank you. PEPFAR has been about saving lives, and that is what it will continue to be about. We are going to increase our ability to be efficient at continuing that effort to save lives, but also as efficient and as aggressive in our efforts to try to prevent new infection. We are going to move in a deliberate and specific way to challenge our program services in country to reside and embed themselves in the public sector gradually over time because we feel it is the best way to ensure that these services remain there for the populations that we've already committed to. The President and the Secretary are fully committed to that effort. I would say it is up amongst their highest priorities, and it is with that conviction that I agreed to move forward with this work.